All right, guys, now we're going to hit microbiology. Okay, this is around 100 questions total between micro and path. There is some overlap between them. The vast majority will no question be pathology. We think about 20 of them will be very specific to microbiology, so we're going to nail those 20 right now. But I'm also going to tie in some examples as we do this lecture of some prominent examples of path as well, just to make sure you're getting some double review and hitting some concepts multiple times. So let's nail these 20, get ready to rock and roll. Do some push-ups if you need to get excited. And let's start with that first heading, which is eukaryotic versus prokaryotic cells. You guys are going to see this exact same visual right here on your screen as what you have in your book. But you can see right away, eukaryotes are you. You are a eukaryote, okay? So make sure you have that in your head. You're simple. Think of it that way. You're simple because you have a very simple cell wall. No peptidoglycan, okay? But you're also fun. You're simple and fun. So think of eukaryotes. Examples are fungi, which we're going to see later on in the lecture. Examples of fungi are going to be molds and yeast. Okay? That's the big picture for eukaryotes. You know, with prokaryotes, the big thing I want to point out here is they have a complex cell wall. We'll get into that more in a second. But you also want to know the ribosomes are 70S subunits. Put an arrow to your right now, guys, in your book. And remind yourself that 70S subunits for prokaryotes can be broken down into 30S and 50S ribosomal subunits. You guys know there are some drugs that work on 30S subunits, right? So take a guess right now, see if you can remember what those are. All right, look at the visual. Right here, you can see it's aminoglycosides and tetracyclines. So you want to buy at 30, you want to buy low, right? So buy at 30, and you want to sell high. CEL, sell at 50, okay? That's how you want to kind of process that. We're going to get into more of that at the end of the lecture, but I wanted to hit that for you now so you can get review later on. Now, the other big thing I want to point out is bacterial cell structure and cell wall morphology, okay? That next heading in your textbook, if you look at that with me, guys, it's the first line says that pretty much all bacteria, right, have cell walls except for two. And those two right there, Mycoplasma and Archaebacteria, are two examples, right, that have been on old tests multiple times. So pause and take a look at that. Let me show you how this was asked on an old test. So guys, now as we get into gram-positive and gram-negative cell walls, I want to give you a visual that you can just draw on your margin to make this super easy for you, okay? When you think of gram-positive, you want to think that it has this very thick peptidoglycan layer, okay? And I'm going to put a T in the middle of this thick layer to remind you that's teichoic acid, okay? This teichoic acid, right, is very specific to gram-positive, so remember, thick peptidoglycan with that T, teichoic acid, in the middle of it. This thick peptidoglycan layer is a great target for antibiotics, okay? So you're going to see like Keflex, which we're going to cover later on in the lecture, which is a cephalosporin, first generation. You're going to see first generation cephalosporins are all about gram-positive, okay? You're also going to see like dicloxacillin, a type of penicillin, is great against gram-positive. They love this thick gram-positive peptidoglycan layer, okay? Teichoic acid in the middle of it. When you think of gram-negative, you want to think thin peptidoglycan layer, okay? Thin layer, but it's going to have a thick outer wall, okay? Thick outer wall, and within this outer wall, you're going to have porins, okay? You're going to see this in your book. Porins, proteins, right, for the passage of glucose and other nutrients can get in there. But you want to think of this LPS complex as being on this outer surface, okay? And if you see LPS on boards, the other word for it they might use is endotoxin, okay? And when you think LPS, you want to think gram-negative, you want to think endotoxin. And this LPS complex, which consists of this lipid A, core polysaccharide, and this O antigen, is what gives this gram-negative charge to the outer wall, okay? So think of that as you're processing that. You also want to know the gram-negative, as it says here in the box, is going to stain more red, whereas gram-positive is going to stain purple, okay? So that's kind of the big picture on how you want to process the gram-positive and gram-negative cell walls. As we get into this next topic, guys, which is bacterial growth, you can kind of pause and skim the video quickly for that. What I want you to pay attention to is right there where it says I, initiation. That's when everything's going to start, right? The cell is going to elongate. When you get to C, period, I want you to think C for chromosome, okay? If they ask you a specific question like what happens in the C period, you want to know that's when the chromosome replicates. Last but not least, you have the D, which is the division period. But what I would really hone in on your notes, guys, is this next portion that talks about phases of growth. So take a look at this visual up here on the screen just to simplify this. I would understand the different order of these steps. So first you have the lag phase. You're getting little to no bacterial growth during this phase. The log phase is when you get exponential growth and peak activity. The stationary phase is here. This is when the rate of cell death equals the rate of cell division. That's the way they could ask that specifically, okay? Rate of cell death equals the rate of cell division. Last but not least is the death phase. So the nutrients run out and the bacteria dies. So guys, as you think about this, I do think this is a hot topic, something you want to hone in on. And let me show you what I think has been, not what I think, what I know has been the most predominant question that's been asked and what I think is the most likely test question you're going to get on these phases. Okay guys, now we're going to get into aerobic versus anaerobic. This has been hit a few times. It's not been a major hot topic, but let me show you just a quick little Venn diagram that summarizes the key concepts. You guys know that aerobic means you require oxygen. So when you think of aerobic, obviously it's going to use oxygen, and when it uses oxygen, you're going to see it's going to undergo glycolysis, okay? Both of these, whether it's aerobic or anaerobic, is going to need glycolysis. That's why it's in the middle of the Venn diagram. But at the end of glycolysis, if you have oxygen, you guys know you go into citric acid cycle, also known as the Krebs cycle. And then after the Krebs cycle, you go into oxidative phosphorylation. So the aerobic one's pretty easy. The anaerobic, you don't have any oxygen, so at the end of glycolysis, you're going to produce lactic acid, okay? And bottom line is here for both of them, they're both going to use glycolysis. They're both going to make ATP, which you probably remember at the end of glycolysis, you produce some ATP. And you're also going to make carbon dioxide in both, okay? That's kind of the key things I would know about them. I wouldn't spend a lot of time on that. Right below that in your notes, guys, you can see spore formation. Okay, pay attention to this. This is really big on old tests. It says gram-positive rods form endospores, okay? This is the main reason, by the way, that this test question right here is likely to come up is it's very hard to kill spores, okay? So which of the following techniques is going to be used to kill spores? Take a look at this question. And another question they continually hone in on is wanting you to know which bacteria produces these spores, okay? So pay attention to this question and see what you got. So guys, you're going to see that reviewed again later on in the lecture, but just remember anthrax, botulism, both of those, Clostridium, C. botulism, right? Pay attention to that. That's going to come up later on in your notes again. So really hone in on that. Pause the video, start a few times, make sure you got that. The next thing we're going to hit, guys, is going to be normal body flora. As you read in that paragraph, it talks about E. coli. I want you to circle that coli and think in the colon, okay? E. coli is in the colon, in the GI tract, okay? Pay attention to that. We're going to see more on that soon. Okay, guys, as we get into the types of bacteria, first thing I want to tell you is that I've been through this a lot. I think we can really simplify this quickly because there's a lot of consistency in what they're hitting. But if you haven't looked at this in a while, some of these odd little details, the first kind of wave through the material is going to seem like, ah, crap, there's a lot of little details here I need to remember. So you might need to pause and kind of stare at it with me. I'm going to give you some dumb ways that I use to help me remember things, but I'm also going to show you a few flow charts so that you can pause the video and kind of get these categories down in your mind. Because you want to be able to say right off the bat, if they say a gram-negative rod, you want to be able to have some bacteria in your mind right off the bat. If they say gram-positive cocci, you want to have bacteria in your mind right off the bat, okay? So be able to categorize. That's the best advice I want to give you right off the bat, and I'm going to help you with that. But also at other points in the video, you might pause and just kind of sketch out your own little flow chart to make this simple for you. But I want to start off with the gram-positive cocci, okay? And the first thing you want to do, and this is huge, it's been on the test over and over again, is you want to be able to categorize these gram-positive cocci into whether they're catalase positive or catalase negative. Catalase positive is going to be staph. Catalase negative is going to be strep. Let's just look at staph for a minute. Staph, you can differentiate Staph aureus from Staph epidermidis. When you say epidermidis, I want you to say everywhere. Staph epidermidis is going to be more prevalent than Staph aureus. Okay? Staph epidermidis, think everywhere. Staph aureus, to differentiate these two, Staph aureus is going to be coagulase positive. Staph epidermidis is going to be coagulase negative. So the take-home message, what I always think of is I always think Staph aureus, I think in my mind, A++. plus. That plus plus means catalase positive and coagulase positive. I use that all the time in my mind. You want to know Staph aureus is part of your normal body flora, but it's way more pathogenic, okay? So it's part of your normal flora, even though it's not as common as epidermidis. When it does attack, man, it is very vicious. And you can see here in your notes, guys, where it talks about abscesses, boils. It talks about issues in the eye, like hordeola, which is a fancy word for a sty, okay? So those are kind of the predominant things you want to know about Staph aureus. It also pay attention to bacterial endocarditis, so it can cause problems on the heart valves, okay? Now, as we get into Staph epidermidis, again, this is everywhere, predominantly on your skin, right? You guys already know it's catalase positive, but coagulase negative. It says right here more prevalent, so it's more common than Staph aureus, but less pathogenic, okay? That's the key things you want to pay attention to. So guys, now as we get into Streptococcus, you know right off the bat it's going to be catalase negative, okay? And as you look in this first bullet point, it talks about how it's in a large proportion of the oral microflora. That's been on old tests a lot. You want to know it's a predominant bacteria found in that area. It also talks about how strep can be classified based on hemolysis. The next thing I want to talk about, guys, is Streptococcus mutans. Take a look at this word with me and break it down. So it means twisted, that's the strepto, the coccus being, the mutants changing, like a mutant. Okay, let me show you a past test question that was asked on this. So to remind you that this is really common in terms of causing problems in the heart after dental treatments, I put a big heart around this one. I think opportunistic, so it's mutant, okay? It's gonna attack the heart, it's opportunistic, and it's also going to change or mutate the enamel surface. So I would think of those two things. I would remember enamel with this one, with this mutant. It's gonna change the enamel. I'd also remember it has the potential to change the heart, okay? That's two big things I would pay attention to. The other thing I would pay attention to is that last bullet point where it talks about dextran, okay? And that's gonna be a major component of forming plaques, okay? So pay attention to that as well. That's in biochem. Remember dextran there. Pay attention to that. Okay, guys, the next one we're going to talk about is Streptococcus pneumoniae, okay? Pay attention to this one. Kind of a quick visual on this. You want to think of it as it grows in pairs, okay? You guys know this is a gram-positive cocci. You know it's catalase negative. That's questions they've asked in the past. All strep are going to be catalase negative. It looks like this kind of pair, and I always kind of say in my mind, pair of lungs, okay? Because it classically affects the lungs. Meningitis, though, is another huge one they've asked on strep pneumonia, okay? So pay attention to that. I'm going to show you another microbe later on that can cause meningitis. This is a big one, strep pneumoniae, to pay attention to. The meningitis has been the top question they've asked by far on strep pneumonia, okay? The other one is Streptococcus pyogenes, okay? If you look at this word with me, strep means twisted, coccus being, pyo, pus, genes producing. So pus producing, you want to think of that first off. The other thing I would pay attention to is I would think pyo, I would think pyro, like fire, okay? So it's going to cause strep throat. It's going to cause like your mouth being on fire. So pyogenes, think pyro. That's the other kind of way I would break that down in my mind. Okay, guys, as we get into the gram-positive rods, I want you to look at this flow chart with me. The first thing I want to point out is, remember, these are going to be your spore formers. So Bacillus anthracis, this is obviously going to be anthrax, right? We talked about this one. It forms spores. No, it's gram-positive. Clostridium was one we mentioned earlier. We said it forms spores. Who forms spores again? Gram-positive rods. Our classic two are anthrax and looking at Clostridium, right? If you look at these different types of Clostridium, okay? Most of them are motile except for perfringes, okay? Think of this as perfringes as perforate, okay? Think of that word to kind of help you remember. Think of it as like perforating the leg so these cannot move. That makes it unique. On a lot of these guys, I wouldn't pay attention to non-motile versus motile. This is one I would pay attention to. Perfringes is non-motile, okay? Now, if you also look Botox, tetanus, these are all types of Clostridium. The big thing with Clostridium, though, is all about spores. It's all about spores. Pay attention to that. As you get in the next one, which is Corynebacterium diphtheria, right? This is a gram-positive rod, causes diphtheria. I would know it's club-shaped. It's not going to cause spores. That's the big thing I would pay attention to as you get into those three types. The next thing we want to hit underneath gram-positive rods is in the box. You can see there Lactobacillus. Now there's like 180 species a lactobacillus species. The take-home message is it's gram-positive, just like the others on this list, but they have a high association with causing advanced caries, lesions, okay? Pay attention to that. That has been on old tests. Highly acidic, right? So it's going to lower that pH. Remember, the normal pH is 5.5 in that area, so pay attention to that in terms of an old test question. Okay guys, now we're going to look at gram-negative rods. Let me give you this big picture flow chart just to take a peek at for a second. We want to start with Pseudomonas. Now if you look at Pseudomonas, that term can be broken down as false unit. It's blue-green in color, and the flagella in Pseudomonas are the false units. So it produces this blue-green pigment, usually has 1 to 3 flagella hanging off of it, gram-negative. You guys remember when this is most common? I mean, burn victims and immunocompromised patients, all right? You want to think gram-negative rod when it comes to Pseudomonas, okay? To get into these next few bacteria, let me show you a question that's been asked quite a bit on this. Maybe you can remember with that bacteria, that AGG at the beginning of the word, think aggressive periodontal disease. That's been asked multiple times on old tests. Really hone in on that. The next one we want to hit is Haemophilus influenza, okay? Now when you look at this, guys, I want to kind of show you this silly little visual to help you remember it. You want to remember first off the chocolate auger, okay? So they could easily ask that on tests. This is a really common infection in children, classically causes ear infections. That's why we have the big ear shown here, okay? And it's associated with chocolate auger. Now, when you think of what grows on chocolate auger, a silly way that I remember it is Hershey's and Nestle chocolate, okay? The H is going to be Haemophilus, the N is going to stand for N gonorrhea, okay? So take a look at that visual, kind of hone in on that for a minute, make sure you get anything on chocolate auger. As we look underneath Provotella, the next one, I want you to take a look at this visual to help you remember this, because on old tests sometimes they have gotten specific about PI versus PG. If you think of PI, again, it's most common in pregnancy, that's the most common culprit. You want to think like maybe pregnant women love pie, P-I-E, okay? Whereas for PG, think if you eat tons of candy all day long, you might get diabetes, right? If you eat candy like a pig, then you might get diabetes. Those are two different silly ways that we remember PI and PG. As we get into gram-negative cocci, we want to really hone in on gonorrhea, okay? You already know it's an STD, you know it's passed on from moms to babies at birth. You want to pay attention to that first line that says it's a gram-negative diplococci. Pay attention to that. Gram-negative diplococci. You already know the chocolate auger along with Haemophilus, right? Those are going to be your top two you want to pay attention to. So as we look at N meningitis, I want you to pay attention to the fact that it can obviously cause meningitis, which is not going to shock you. But look at this visual to remind you, when it comes to meningitis, it's not just N meningitis, it's also strep pneumonia. Those are the two different causes. But remember, strep pneumonia is a gram-positive cocci, right? Whereas this one, meningitis, is going to be a gram-negative cocci. So pay attention to that. This has been on old tests. They want you to know the causes of meningitis. You know patients with meningitis are going to have that neck pain, right? Which is another association they want you to pay attention to. The next one, guys, Bordetella pertussis. You want to hone in on this. This has been multiple times wanting you to know it's the cause of whooping cough, right? So literally write this one down. It's been all over old tests. It's an easy one that you can just check and move on with your life. So pay attention to that. Make sure you know it's a gram-negative cocci as well. As we get into gram-negative enteric bacteria, make sure you understand enteric is going to refer to the intestines, right? And as soon as you see intestines, when you look at this, you want to think E. coli, right? So E. coli, you guys remember, is going to be in the colon. It's non-encapsulated. That's a really big thing. Circle that, guys, in your book. First bullet point there, non-encapsulated in the colon. It's part of the normal flora, right? When it gets out of that area, though, it can be really bad, like causing epidemic diarrhea, really bad diarrhea. So pay attention to E. coli, non-encapsulated. Okay, guys, the next one is Klebsiella pneumonia. I want you to look at this visual, because another thing they could do to you on the test is just differentiate the causes of pneumonia. So you want to pay attention to strep, mycoplasma, which we'll cover in a little bit, and Klebsiella as being the different causes. Again, just be able to kind of associate those and understand if they mention that buzzword of pneumonia, you can be ready to figure out which one they're going after. The next thing we're going to look at is Proteus mirabilis, okay? Proteus, remember in Greek mythology, this was the same thing as Poseidon, which was the sea god. So just right above that, sea god, and kind of pay attention to this, because if you look, first bullet point, motile, next bullet point, swarming growth. swarming growth, and it also is kind of classic with this fishy odor. So think Poseidon again, fishy, right, in the sea. You want to pay attention to the fact of its problems are all in the GI tract. That's obviously the type of bacteria we're talking about. But look, it's all kind of peeing type issues, right? Kidney stones, urinary tract infections, issues like that, okay? I should say urination and defecation issues, but think of that as being what you want to remember about this particular bacteria. The next one, everybody, is Serratia marcescens. This one's very rare. It's not going to be likely to be asked on your test. If they do ask you a question, take a look at this visual. This is a silly way I remember it. When it's pathogenic, it's very, very serious. So you want to like stop when it comes to this one. Be very aware of this one because it can cause red pigment. That's why I have the stop sign. Marcescens, think stop, slow, very dangerous, red pigment. That's what you want to remember with this one. Can cause very critically ill patients. The next one, actinomycetes. Pay attention to this one closely. That first bullet point, guys, let's look at that together. Microflora of dental plaque. This is part of the normal flora and it can cause plaques. It's very likely to be asked. It's been asked over and over again. The more likely question, though, besides that, that's been asked even more common than that, is that it causes the sulfur granules. If you scroll down, you'll see sulfur granules there. That's big time, big deal. Literally over and over again, these oral abscesses with sulfur granules has been asked, literally verbatim. If they want to get a little pickier, they might want you to know in that same sentence of sulfur granules that it's anaerobic. It's an anaerobic rod. So hone in on that, okay? That's been asked over and over again. I love to be able to tell you that because it's kind of like red alert. Nail that one and then pat yourself on the back on the test and say, good job. The next thing we're going to hit is Mycobacterium. When you guys see this, you're probably thinking tuberculosis, which is good. If you look at that first bullet point, though, it says it stains just a little bit gram-positive, acid-fast, right? You've heard that phrase many, many times before. Let me show you how this was asked on an old test, how they took this basic concept to another level. As you look at your book, guys, I want you to look at myco, right? And I want you to circle that and write micro, like small air droplets, okay? I want you to think of micro, like small air droplets, because that's how this is basically transmitted, right, and is so infectious. So as you look at here, you guys know second bullet point, it can cause tuberculosis. You know night sweats is a big one you want to hone in on. That's the number one symptom of a tuberculosis patient and something you want to know. If they ask you on the exam, does this type of patient have caseous necrosis or liquefactive necrosis? You want to say tuberculosis causes caseous. And if they ask you if it's granulomatous inflammation or non-granulomatous, you want to say granulomatous, yes, okay, so you're all over that. Okay guys, the next category we're gonna look at is spirochetes, and you wanna pay attention to that first sentence, spiral shaped with axial filaments. That's verbatim, been on multiple tests, and you wanna take a look at this visual with me to get kind of a big picture understanding of the spirochetes. The first one is one you've seen many times, Treponema pallidum. Okay, so you obviously know this is the cause of syphilis. You know syphilis can be congenital or acquired. If it's congenital, it's passed on from the mom, okay? And you want to know the different stages. So look here in your notes with me, okay? The primary stage is where you get the canker, right? And it's going to be a hard sore at the site of entry. You know the secondary stage is where they're going to get this fever, sore throat, right? They're going to have in the oral mucosa, they're going to see symptoms. That's what makes it a great question for you. And you want to pay attention to the secondary stage is very, very contagious. Write that in capital letters. Very contagious, very likely to be asked. If you see this term right here, take a look at this visual. Okay, you want to pay attention to that. That's like a wart-like lesion in the genitals. That is secondary syphilis. Okay, if you see that, write secondary syphilis. For tertiary, you guys know this is neurological. You guys know this can cause people to be blind, deaf, insane. It's not contagious. That's something you want to pay attention to. And if you see this word on boards right here, you want to pay attention. This is going to be in tertiary syphilis. Okay, this is where you get syphilitic myelopathy and other symptoms of nerve damage in these patients. All right, so pay attention to those terms. Be ready for them on boards. And also congenital syphilis, you guys know there's some classic buzzwords here you've seen many times in your notes. You see Hutchinson's, incisors, Mulberry, molars. Those are ones you want to know, obviously associate them with congenital syphilis. The next two, chlamydia and rickettsia, what do both of those have in common? Do you guys remember anything about that makes them similar? They're both obligate intracellular parasites. That's been asked on old tests to want to know that those two are obligate intracellular parasites, so pay attention to that. And if we look at chlamydia, you guys know this is your number one STD. It causes pain upon urination. You know that it's the leading cause of ophthalmia neonatorum. And actually, if you didn't know that, look here at this term up here. This is conjunctivitis in a newborn. Okay, so they ask you on boards, chlamydia, not gonorrhea, chlamydia is the most common STD, most common cause also of ophthalmia neonatorum. Similar to bacteria in that they contain DNA and RNA, but similar to viruses in that they're obligate intracellular parasites. So know that chlamydia has a little bit of both, okay, and that's a common type thing you'll see on test questions. Now, if you look at rickettsia, look at this word with me for a second here on a visual. I want you to kind of switch those letters around and think tick right there. Really think tick with rickettsia. This again is an obligate intracellular parasite. You know it has this classic triad as you look in your book of headaches, fever, rash. You know it's associated with Rocky Mountain spotted fever. Okay, rickettsia, Rocky Mountain spotted fever, think tick. That's the big thing. Last but not least is mycoplasma. The huge thing, and you're not going to miss this, you're going to be all over this, is that mycoplasma has no cell wall. So as you can see in the box right there, it talks about how if you don't have a cell wall, penicillin, right, is not effective. But right above penicillin in your box, write another type of antibiotic that's not effective if there's no cell wall. The other major one I would know is cephalosporins. Penicillins and cephalosporins attack the cell wall. We'll talk more about that at the end of the lecture, okay? But for now, that's a big thing you want to pay attention to, makes for a great question. Make sure you also know about mycoplasma pneumonia, as it says here in the book, that you get a non-productive cough. That's another key thing I would pay attention to. The next heading, everybody, is antibiotic prophylaxis protocols. As we glance at this together, I want you to look, first of all, where it's recommended. And you're going to see the dosage here in a second, okay? But first of all, it says artificial heart valve. So you're going to see that's always going to be a yes. No matter what you see in the notes, it's always a yes. The next one is a history of an infection in the heart, yes. Next one after that is looking at, basically 4 through 6, is all about repaired congenital heart issues. If you ever see that, repaired congenital heart issues, always yes. You want to obviously do the antibiotic prophylaxis. If you go to those exceptions on the next portion of our notes, you'll see congenital heart problems in general are not necessarily going to need the antibiotics. It's all about the word repaired. That's what I would hone in on the test. As you get into the total joint replacement heading, I honestly would just kind of skim it because there's been some discrepancies in the past and there's been some discussion and arguments back and forth on what the right thing to do is. So that does not make for a very good test question. Pause it, skim it, move on with your life. As you look at the next heading, though, that talks about antibiotic regimen, it gets into the actual dosages. Pay attention to amoxicillin right there. You're going to see it a little bit in a few pages. Amoxicillin is a very good broad spectrum penicillin. It's going to have pluses and minuses. Take a look at this visual. I want you to picture amoxicillin this way with all these pluses and minuses around it. But you guys know it's very susceptible, though, to penicillinase. And so you have to put a big C around it, which is going to be clavulanic acid. And when you do that, you get a new antibiotic, and that's called what, guys? It's called Augmentin, yes, okay? But for this scenario, you want to think of Augmentin as being kind of the go-to drug, 2,000 milligrams, okay? 2 grams or 2,000 milligrams. I would just think of milligrams, 2,000 milligrams, 1 hour right before the procedure. When it gets to clindamycin, it's also how long, guys? How long do you want to prescribe this before the event? 1 hour again, okay? So both of them are 1 hour. Don't lose that on the test. This one's a little less, 600 milligrams, okay? Now, as we get into the next heading, guys, laboratory isolation, culture, and identification of bacteria, this is a pause and skim and has not been high yield. It's very basic, but take a look at that briefly on your own, and then we'll move to the next topic. The next heading we want to hit, everybody, is where it says quality control, sterilization, and disinfection. Okay, this is a big heading. The sterilization here is huge, okay? Not very often would I tell you like memorize numbers, like really hone in on numbers, but this is one of those moments. And I'm going to help you review it now, but this is a big deal, a page you really want to know well. It's been smothered all over old tests. So let's look at this together. First off is sterilization, okay? Sterilization is going to eliminate everything on a given surface, including spores. So say that to yourself. Spores, sterilization. Sterilization, spores. Sterilization is always going to get rid of those spores. That's the key thing you want to know about with sterilization. The others are not going to do that. Okay, that's the test question you see most commonly. As you get into these examples, like autoclave, for example, you want to know, by the way, in the notes as it goes from 1 to 5, the different examples, it starts with the least amount of time and works its way up. So autoclave is only 15 minutes, whereas dry heat is going to be 2 hours. Ethylene oxide, 8 to 10 hours. Okay, as you can kind of see it work its way up, but I would definitely know autoclave, it's going to be high pressure steam, okay, and know those numbers, 121 degrees Celsius, 250 degrees Fahrenheit, 15 minutes. Dry heat, I would circle that D at the beginning of dry heat, and I would think everything's going to be doubled. Look at what I mean by that. First of all, 160 degrees Celsius times 2, 320 degrees Fahrenheit, okay, for how many hours? 2 hours, okay? Think of that number 2 when you think about this. It all starts with 160 Celsius, 320 Fahrenheit, 2 hours, dry heat, okay? That's going to be the key things I would know about that. Dry heat was one of the earliest methods. Has kind of gotten replaced by more sophisticated things. Ethylene oxide is a classic type of sterilization technique that's great for healthcare devices and instruments. You could add that to your notes if you'd like. But again, just kind of hone in on that and the key points there. Let's get into disinfection next. And this one's very different from sterilization in that it does not always kill the spores. That's the key thing you want to pay attention to. You can see there's different examples. Phenol there, the second, is going to denature proteins. That's the key thing I would know about that, and that is an example of a disinfection technique. Last but not least is antiseptics. You want to think of antiseptics as being able to use on your auntie, like your aunt. You can use it on living tissue. That's a key thing I would pay attention to. You can see alcohol is a big one here. Iodine is the other one I'd really hone in on. But those are examples of antiseptics. So I would kind of clearly, these 3 methods, look at this visual one last time, get those organized in your head so you can quickly get those questions right on the test because they're always asked. Okay guys, now we're going to talk about virology. And in that first sentence underneath that heading, you can see that viruses are obligate intracellular parasites. Now, tell me what microbes we've already studied that would fall in the same category. Do you remember what they are? Rickettsia, yes. And what else? Chlamydia, yes, those 2. And by the way, when you see rickettsia, do you see tick in that word? Good, that's good. That's what you want to know for boards. That's great. Now, I want to show you this kind of schematic of a virus. I want you to see the capsid here and the nucleocapsid core. And I want you to remember that viruses do not have organelles. They either have DNA or RNA, not both. Okay, that's kind of key things you want to know. Okay guys, now we're going to get into classification schemes for viruses on DNA versus RNA versus nucleocapsid versus enveloped. So as you look at this, the take-home message that they're going to go after on these examples is to know, is it DNA or RNA? Is it enveloped or is it nucleocapsid in its nature? Okay, so pay attention to that, kind of draw out your own quick flow chart to be ready for that. I don't think you're going to get a lot on that, but maybe a question to pay attention to. The next heading we want to look at, everybody, is viral replication in host cells. I would pay attention to this, okay? It says there that when you think of DNA viruses, they're going to replicate in the nucleus, okay? Whereas RNA viruses are going to replicate in the cytoplasm. That's kind of a general rule of thumb. I would know the exceptions. In particular, I would know that HIV, for example, even though it's an RNA virus, it's going to be a big exception. It's going to replicate in the nucleus, okay? But in general, you want to think DNA, nucleus, RNA, cytoplasm. As we get into different types of viruses here, adenovirus, I would definitely know it's double-stranded. It's a DNA virus. And when you look at some of these visuals here, pneumonia, viral pharyngitis are going to be your classic 2. And here's what kind of the non-enveloped double-stranded DNA virus looks like. Herpes is definitely one you want to pay attention to, guys. This has been all over old tests. That doesn't shock you, I'm sure. Most of you guys know type 1 is primarily above the belt. Type 2 is below the belt. I always think of it like it takes 1 to get type 1, takes 2 to get type 2. And as you look at this, take a look at this visual, you want to think of herpes simplex is looking like this, okay? It's going to be polyhedral, which means it has many different sides and it's double-stranded. Many times, guys, it has like 20 different triangular faces that look like this. So again, for herpes, you want to think polyhedral, double-stranded, okay? That's kind of the key things I would pay attention to about it. You guys know a big thing to know about it is going to be that it hides out in the trigeminal ganglion. That's the cranial nerve 5 ganglion. You probably remember the trigeminal ganglion ends up dividing into V1, which is above the eye, V2, which is below the eye, V3, which goes here to the mandible, okay? So when you think about cranial nerve 5, the trigeminal nerve, V1, V2, V3, so this virus kind of reactivates out of that when there's a lot of stress, right? Or when you think of UV light, okay? That's gonna cause this to happen. As you look at this next page, guys, I think the classic things I would pay attention to are what the different viruses lead to in terms of pathology. So there's definitely some overlap here when you think about how this could be asked in your pathology notes, okay? So let me show you just a visual here to kind of put you on the spot. If they mention the term mononucleosis, okay, what virus is associated with that? It's going to be Epstein-Barr virus, yes. If they talk about AIDS, you want to think about cytomegalovirus. If they mention molluscum contagiosum, you want to be thinking DNA pox virus, okay? And if they talk about cervical cancer, you want to be thinking about HPV, okay? Those are the key kind of no-brainer things that they've asked on old tests and something I'd pay attention to. The next big topic is going to be hepatitis. And by the way, if you want to pause and glance at the previous stuff I just mentioned, you can do that quickly. It's mainly been, again, connecting the virus to pathology. I wouldn't spend a lot of time on that. What I would spend time on is hepatitis. I would know these really, really well. You obviously know there's A, B, C, D, E. I would definitely know which ones are associated with fecal oral. And the phrase I always remember about this is bowels and the vowels, okay? So A and E, bowels and the vowels, are going to be associated with fecal oral transmission, okay? That's a good test question and one that I would know really, really well. I would also know which ones have vaccines, okay? Which are going to be Hep A and, you remember what it is? Hep B, yes. Do you guys remember which one of these can be treated by interferon? That was going to be Hep C, yes. And remember Hep C, okay, is the one that's chronic. That's the one that's chronic and the one you should know really well. With D, I always think you can't get D without first getting B, okay? Carried only with Hep B. So those are the key things I would know, and you'll be all over hepatitis for the test. The next one, which is Coxsackie virus, I would definitely know hand, foot, and mouth. And if you see this word right here on the test, you want to think that's just kind of a fancy word for hand, foot, and mouth. Herpangina, that's one that you want to pay attention to. You want to think these patients are going to have sudden fever, sore throat, headache. The big reason why they want you to know this on the test is that it causes blisters that ulcerate in the mouth, okay? Coxsackie virus, dominate that, literally almost always on old tests, really high yield. You'll be all over that on the test, okay? Make sure you pay attention to that one. The next heading that talks about laboratory isolation, culture, and identification of viruses. You can pause and skim this. It has not been big on past tests at all. It's just kind of there for your reference to give you some context if you want it, but it's not something big I would spend a lot of time on. The viroid-like structures, you can see here viroids, right? And you can also see prions. The reason I said viroids like that is whenever you see this on the test, you want to think it's an RNA virus. Now look at this visual with me. When you think viroids, you want to think single-stranded RNA virus. Hey, by the way, where do RNA viruses typically replicate? Cytoplasm, yes, good job. With the exception of which one? HIV, where does that replicate? In the nucleus, yes, good job, guys. Very, very good. Again, high yield concept there. Prions, I always think with prions are proteins. Look at the PR at the beginning of the word. Prions are proteins that promote CNS damage. Proteins that promote CNS damage. They're infectious, and you need to know what's in the box, mad cow disease, okay? That's what's been stressed on old tests. I would know that it takes over the protein machinery. It's not nucleic acids. So you'll see in your notes there, it doesn't take over DNA or RNA. It doesn't have DNA and RNA. It has proteins. That's what it takes over in terms of the machinery. That's the test question I would hone in on.